Not including skin cancer, colorectal cancer is the third most common cancer diagnosed in men and women, and is also the third leading cause of cancer-related death in the United States, according to the American Cancer Society. Unfortunately, not a lot of people know about that. But luckily, there is hope. In 2018, the American Cancer Society came up with new screening guidelines that'll help save more lives. Hi everyone, my name is Susie Lowry Hall and I'm Enloe's Community Outreach Coordinator, and I'm joined today with one of my favorite guests, Rebecca Senoglu. Hi. And she is the Enloe Cancer Support Coordinator. Today we're going to be talking on this important topic in honor of National Colorectal Cancer Awareness Month. But before we get started, please remember that the information that we're about to share is not intended to be medical advice. If you have questions about the health of yourself or a loved one, please make sure you speak with your provider. But as always, please join the conversation. Put your comments or questions in the comments field and we'll do our best to answer them throughout the broadcast. And with that, we'll get started. All right, Rebecca, thanks so much for being here. So in preparing for this segment, I was really surprised to learn that colorectal cancer is so common. Can you tell us more?
Yeah, and it's really disturbing considering the fact that we can completely stop colorectal cancer if it gets snipped out as the precancerous polyp during a colonoscopy. And even if it has grown into a small tumor, if it's caught early before it has spread, there's a 90% survival rate, 5-year survival rate for colorectal cancer if it's caught early. But unfortunately, if people don't get screened and it has spread, then the survival rates are much, much lower.
That's amazing. So let's talk about screenings. The American Cancer Society has updated the screening guidelines. What do we need to know?
I think one of the most important things is a trend that we're seeing, which is that more people under age 50 are getting colorectal cancer. I mean, most people who get colorectal cancer are still over 50, and I think that's kind of what we have in our mind, 50 is the age. But in the last 2 decades, the number of people under 50 getting colorectal cancer has doubled. And so the American Cancer Society is now recommending that people of average risk, 45 is the new 50. 45 is the new 50. Now the Centers for Disease Control and insurers, they're still recommending screening at age 50, but the American Cancer Society takes the lead when they see trends like this, and then hoping everyone will follow.
So you just talked about the average risks of someone. What about somebody who, what risk factors would put someone at high risk?
Yeah, I think most of us think I'm average risk. I don't need a colonoscopy till I'm 50. But actually, if you have a personal history of colorectal cancer or anyone in your family has a history of colorectal cancer, and that includes the polyp, that includes the precancerous polyp, then you are not considered at average risk. You're considered at a higher risk. If you have a personal history of inflammatory bowel disease, like Crohn's disease, if you have a confirmed or even suspected hereditary syndrome, like Lynch syndrome, there's these things that increase your risk of getting cancer. And less common is if you have if you've had radiation to your pelvis or belly, that can increase your risk a little bit.
Okay, so what are the signs and symptoms of colorectal cancer?
So for younger people in particular, it's important to know the signs and symptoms. And this is the fun stuff.
Okay.
Get
ready, everybody.
Change in bowel habits.
Okay.
And feeling that you need to have a bowel movement even after you've gone, rectal bleeding with bright blood or dark blood in the stool, cramping and abdominal pain, weakness and fatigue, and unintended weight loss are all signs and symptoms of colorectal cancer. Unfortunately, it's common, at least initially, for many people to dismiss a lot of these signs and symptoms and think, well, I'll wait and see if it goes away. But as we've just pointed out, colorectal cancer, it's really important to catch it early. It makes all the difference. So if anyone is experiencing any of these signs and symptoms, it's good to have it checked out. At any age.
Yeah, I would second that. I'd echo that. So let's get down a little bit to the nitty gritty. So when we're talking about screenings, we're really talking about colonoscopies. Yes?
Yes. A colonoscopy is still considered the gold standard of colorectal cancer screening. I mean, you only have to do it once every 10 years. And when you get a colonoscopy, they can actually snip out any of those precancerous polyps at the same time, which makes it the #1 way to prevent colorectal cancer.
So how would somebody go about getting a colonoscopy, or what's the steps to getting that done?
So like most cancer screenings, you begin by talking to your primary care physician. And if you know you need to be screened, but you don't have a primary care physician, which is a fairly common problem in our area, we recommend you work to get a primary care physician. And Enloe has an online directory for that. And there are also some immediate cares that will make a referral for a colonoscopy if you need a colonoscopy. So that's an option if you don't have a primary care physician. But to get a colonoscopy, you need a referral, and because colonoscopies are done by specialists. And the Enloe Digestive Diseases Clinic and our colorectal clinic do colonoscopies. And something I want to point out is that when you're in their care, you are in good hands. I think people are often nervous about the procedure of getting a colonoscopy, but Enloe is one of America's 100 top hospitals in gastrointestinal care, and Enloe was recently, that's from Health Grades, and then Enloe also recently received a top performer award in colon cancer surgery from US News and World Report. So Enloe does this well.
Oh, well, congratulations.
Yeah.
Yes, it's exciting. Yeah. So the American Cancer Study has also broadened its guidelines for other types of cancers. Can you share those as well?
Other types of colorectal cancer screening, yes.
Yeah. Thank you. Yeah.
And, you know, even though we've known for like decades that colonoscopies can prevent colorectal cancer screening, they still have not been able to get to this goal of 80% of the community being screened. And I get it. Like, I remember talking to a World War II vet that had served in the trenches, right? Mm-hmm. But he wouldn't get a colonoscopy. And so there are some people who just don't want to get a colonoscopy. So in recent years, stool-based tests have become more reliable. And they're called a FIT test or an FOBT. But the thing about stool-based tests, doing a stool test, is you need to do it every year to be effective. So you need to kind of think of it like your flu shot. You have to get it done every year, whereas colonoscopy is once every 10 years. And the other thing about the stool-based test is that if you get a positive for any reason on that, then you must get a colonoscopy. It is not a screening test in and of itself. But for some people, you know, getting the yearly, doing the yearly, you know, mailing in your little packet is easier than dealing with getting the colonoscopy even once, unless they know they absolutely need it. And that's what the American Cancer Society guidelines are saying now, is providers and patients need to discuss which option is best for you.
Okay, great. So that was all really great information, and now we know people have options.
Yes.
That's nice to know too, so thank you for that. Lastly, let's talk about what people can do to prevent colorectal cancer.
Okay, so the number one way to prevent colorectal cancer and any other, there's 12 other types of cancer that are directly related to weight, maintaining a proper weight. Next to smoking, obesity is the number one risk factor. And we know with colorectal cancer also that a diet in red meats and processed meats is you want to reduce that. Smoking, of course, and alcohol consumption. Reduce or eliminate those. And increase your fruit and vegetables. It's so easy. It doesn't, it doesn't take a lot of studying up. Fruits and vegetables help move things through. The processed meats are not that good for you. And keeping a healthy weight is the number one ticket for all kinds of health things.
Great. And if anyone who's watching is interested, you can go to our Healthy e-library at enloe.org if you're looking for some recipes or some ideas on how to, be active and stay healthy. So you can check that out as well. Well, Rebecca, this has all been really great. Thank you, of course, for being here. Is there anything else you want to say before we sign off today?
Yes. You don't have to be afraid to talk to people about colorectal cancer screening. I've just sat here on Facebook Live and talked about bowel movements. So, so talking to your family, finding out if you have family history, talking to your healthcare provider about your options and any signs and symptoms that you might be experiencing. The thing that we know is that with any type of cancer, the proper screening saves your life.
Yeah, screenings, I agree. Thank you so much. So hopefully you took some notes and you'll be getting your screenings on your next appointment. But thank you all for being here. Thank you, Rebecca, of course, for being here. And we'll see you guys next month when we talk about the opioid epidemic at our next Facebook Live discussion. Take care.